Hi, everybody. Ginger Lumen back here with another speaker spotlight for our Moving the Needle conference happening this June 21st, 22nd in Wichita, Kansas. And I am so happy to be sitting with Vanessa Lohf today. Hey, Vanessa, say hi to everybody.
Hi, everybody.
So Vanessa, I want to get this right because Vanessa is a project specialist for the Center for Public Health Initiatives and the trauma-informed systems of care that they have. She's not, you are, but you're not an educator. You're both, right?
I do a lot of training for adult learners. Perfect. So I am actually a social worker by trade, but a vast majority of my work right now is training.
I love it. And that's one of the reasons why we want you here at our Moving the Needle conference, because this isn't just about what's happening in schools. It is this full wraparound care that we have for our people. Vanessa, you're going to be talking with our folks about developing the building resilience through H.O.P.E as an acronym. You're talking about the ACEs and PACEs. Tell us more. What gets you excited there?
Well, H.O.P.E is a new framework, relatively new, like in the last 2 years, that was developed by Tufts Medical Center. And it stands for Healthy Outcomes Through Positive Experiences. So many of us have heard, and most of my life as a social worker has been around this work of ACEs. And many educators and others in the communities have learned a great deal in the last 10 years, especially about adverse childhood experiences and the impacts that those have on the brains and bodies of kids and adults alike, and on our communities, not just at the individual level, but at the population level. And what this framework brings to us is hope. A lot of folks get really depressed when they hear about ACEs and all of that negativity. And sometimes we forget to talk about how we can counteract those kinds of impacts, even when kids have them, through those positive experiences. So this particular framework gives us a very concrete way. It's rooted in science. There's some great research that's come out of this work to show that the types of experiences that we can offer to kids and families and communities can actually counteract some of the impacts that those folks might be experiencing even when they go through tough times.
I love that there's something that we can do.
Yeah.
So then when people walk away from your session, what is it they're going to be able to do, know, understand?
Well, my hope is that they will understand HOPE a little better, what the framework is, but then have a conversation. So I plan on asking questions. Folks that come to my session better be ready to answer some questions for themselves. And that is, what are they already doing that supports that framework? What are they having trouble with, and what's getting in the way of integrating these things into their everyday practice? And what could they do? What could they be doing better to, and come away with maybe even a little bit of a plan of what they can do individually, even if their organization or school or classroom isn't formally integrating this into their work. They can think about what they can do individually to support each of the 4 building blocks that are part of the framework.
Love it. Vanessa, thank you so much for being part of our Moving the Needle. So friends, again, this is June 21st, 22nd in Wichita. If you want to know more information or how to get registered, you can go to esdac.org/MTN2022. I can't wait to see you there, and I'm going to sneak in on your session.
Yay. I hope you do.
I will. All right. Thank you. See you guys.
Thanks, Ginger.